Thanks, Neil. Afternoon, everyone. Great to have so many of you here. I know some of you, but not all of you. My name's Dan Sherlock. I work at Surrey County Council, leading our Empowered and Thriving Communities programme. And I had the pleasure with other colleagues, was it probably 18 months ago now, when we were sort of putting heads together and thinking, how do we work better with communities? How do we do that as partners? How do we create health? How do we build capacity in communities so they can follow their dreams, hopes, support each other? It's really exciting today to have everyone gathered to share the work, the learning, the hard stuff, the things that have worked, the practical things, the learning that's happened over the last 12 months through this programme. And we'll be dedicating most of that time, you'll have seen the agenda, to hearing from each of the different action learning groups in different localities across the county. And I'm really looking forward to hearing those different reflections today. We've also got a bit of time on the agenda to which Jill Oro will chip in on, to think about how we continue this learning together, how we continue to do the great work connected in local places with communities, but also share the learning and support each other across the wider county as well. And also, in addition to the action learning groups, think about some of the sort of wider pieces of work and thinking and action that the programme has stimulated. So I guess in advance, a huge thanks to everyone who's sort of participated in this. I know Neil will talk a bit about how sort of running a learning programme like this has worked from the Health Creation Alliance perspective. But yeah, just a massive sort of advance thank you for all your contributions. Feels like a growing movement really across the county, nationally as well. So yeah, lots more to do, but great to be able to have the chance to listen to each other's reflections today. Really quickly on the practicalities, all the usual things with an online session. So we'll be, and I know we'll control the sort of spotlight and the mutes and things like that as we go, which is always really important. Also, it is quite draining, isn't it, being online for a prolonged period? We've got a couple of hours for this. We might get slightly ahead of time, we'll see. But we've also built in a break halfway, so grab a cuppa, stretch your legs, look away from the screen for a bit. I also know some people may need to come and go a bit, so please do that as you need to do. I think the other thing that's helpful in these sessions, and I see some have popped up already, is to use the chat. Please do use that. Use the reactions. It's always interesting when you're sort of presenting into a screen. It's harder to read the room, the virtual room, isn't it, than an actual room. So yeah, do embrace that. We'll tidy up and sort of anonymize the chat afterwards to sort of leave us with a flavor of any of the conversations that have happened there, or the threads we want to pick up on afterwards. So yeah, do please hit the emojis, etc. as we go. And as we've got a couple of minutes before we get to the next item on the agenda, just invite everyone to have a brief moment of reflection yourself about the work you've been involved in the last sort of 12 months in this programme, obviously, but more broadly in your day-to-day life. And thinking about the way you've been working alongside communities. Just be really interested. I don't know if this is going to work, but let's try it. In a kind of one-line glimpse into a moment or a conversation or a quote or an event that's kind of stuck with you from the last year. And I'll try and give my own example to help with this, and just pop it in the chat. I know sometimes we put in the chat like, here's my name, I work in this organisation. We've got the mail list of everyone who's in this group, so we can share that separately. But I just think it'd be really interesting, if you don't mind, sort of take a moment and pop into the chat a sort of, I guess, a memorable or important moment for you in terms of the way you've worked with communities over the last year. It could be tiny, it could be small thing, whatever. I think mine, just to sort of get us going, would be we were doing some, we were involving the community in some recruitment of a role in Goldsworth Park in Woking, and it's one small example, and we were, I guess, trying to shift some of the power in the decision making over who got that role to the community. And I think at one point in the process, we were saying, well, you as a community group, whoever you have a consensus on and think should go through to the final interview, goes through to the final interview, and whoever doesn't. And one of the community members there said, so we actually get to decide that. Yes, you do, and that's sort of, so we actually get to decide. Just stuck with me. Obviously that was one example, one context, but yeah, it'd be great if you could take a minute. We'll sort of have exam conditions briefly and just drop in a little reflection or a moment from the last year that you'd like to share. And hope you can all hear me. I think some might be struggling a bit with the sound. We'll have a look at that as we go. But yeah, just take a minute, reflect, and pop something in the chat if you wouldn't mind. Thank you.
Hi, Dan. While people are doing that, I just checked in with a few people. Actually, I think it could be some particular people's sound, but I think your sound is okay. It's okay.
Thanks for clarifying that, Neil. Appreciate that. Sometimes if people are struggling, the old log out and log in works, doesn't it? So that might be worth trying. Yeah, thanks for sharing some great reflections coming through there in the chat. Prevention is the key, working at an early age, respect between community members, building trust over time. I know we'll get a lot more of this, but I just wanted to take the opportunity for, I know some people are presenting today and some are listening and reflecting, just to sort of get some quick views. Thanks, Trevor. Yeah, putting lived experience in charge, great way of summing it up. Yeah, so I need hard to reach it. I know we increasingly avoid saying that, don't we? It's like maybe it's our problem, we're finding it hard to listen. Community spirit. Yeah, these are really lovely. I'll just carry on. We'll move on with the agenda, but yeah, do keep sharing those in the chat. I think that's going to be, it's really important to sort of get a sense of our different sort of experiences of this and reflections. But thank you so much for those. So I'm going to hand over to Neil, who's just going to from the Health Creation Alliance. He's just going to give us a few I guess reflections and maybe a bit of a reminder on the kind of way we've gone about this program over the last 12 months. Neil, over to you. Thank you.
Okay. Thank you very much, Dan, and thank you for that introduction. So most of you probably know me. I'm Neil McGregor-Patterson, and I'm the Director of Communications for the Health Creation Alliance. And while I'm only presenting for 5 minutes, and Lee, could I just ask you to take over allowing people to come out of the waiting room? That would be great. So yes, so I'm the Director of Communications for the Health Creation Alliance, and I was responsible in terms of this program with a lot of the logistics and the administration side. And I know a lot of you will have received emails for you, or emails from me over the period of the last year, just over a year and 14 months. So what I wanted to be able to share with you this afternoon is just a reflection on just a few of the program outputs. So it's not for me to take a look at, what the specific outcomes were and what the ALGs learned, etc., and what people did as a result of being in the program. But I thought I'd just share some of the headline figures in terms of what I would call the scores on the doors. So first of all, just to recognise that this was very much an evolving programme. So the programme was a 6-phase programme, and we started engaging with Dan and Helen, who are the programme sponsors, about 14 months ago. And the really great thing about this programme is it evolved over time as people's needs and ALGs and people's and everyone on this call's needs changed. And it was developed as a true partnership between myself, Maren, and the team at the Health Creation Alliance, and Dan and Helen and the team at Surrey County Council. And I think that's really was very important in delivering on the impact of the programme. And when we looked at some of the scores on the doors, this was a program where there were 9 versions of the overall plan at the beginning, and that involved 3 site visits with myself, Maren and Lee, and 3 digitally enabled engagement meetings. So through that process, we engaged with 55 different people across Surrey, both from the NHS, from local authority, from communities, in ensuring that the final programme actually met people's needs and actually really advanced health creation across Surrey. We currently have 272 people on the health creation mailing list. So while some of you will be here, but these are people who at some stage have engaged in the programme or have asked to be kept up to date with the programme. And we will be sending out the video from this afternoon, a link to the video to all of these people so they can see what went on and share in the learning and the celebrating success from the meeting this afternoon. We've had 130 people attended this time last year in July, and also in August we had 130 people attended the opening events to learn more about health creation and the programme across Surrey. And out of that, and kicking off in October last year, we have 14 PCNs involved in 8 individual action learning groups. And so far to date, I think we've now probably finished them all, there have been over 30 individual ALG meetings facilitated and supported by Maren and our individual associates, who, and I'm sure some of you are very familiar with, and Maren will be thanking them towards the end of today's presentation. We've also presented to some of the protected learning times, and we had over 80 people attended individual sessions around health creation as part of the protected learning time. And interestingly, and which is good news, and I'd see that Lee has already shared the link, the microsite, or it's a resource site where there's a rich resources and templates and tools and background to the whole of this program, which are actually formally being launched today, has already had over 200 visitors. So even though it hasn't been formally launched, people are still finding it very useful in terms of supporting their understanding of health creation and supporting the understanding of how to work with equal partners with communities to create health. So that just gives you a little bit of a top line of some of the outputs to it. And Dan mentioned that actually the learning is going to be continued. It doesn't just stop with the launch of the microsite. And I'm delighted to be able to hand over to Jill Oro. And Jill is going to be talking about the new Surrey-wide community of practice. So if I stop there, then if I find Jill. Jill, welcome to this afternoon's meeting.
Hi everybody, and thank you so much, Neil. Can everybody see my screen?
Yes.
I can't see you. Yeah, fantastic.
Yes, yep, I can see that. I think everyone else can. Yeah.
Yeah, wonderful. It's fantastic to be here. And what an incredible group of people that I'm on the call with. I can tell from knowing many of you through my work, but also from everything that's going into the chat, that this is an incredibly energized, health creating group. So it's an honor and privilege to be here. And for those of you who don't know me, I'm Gillian Oro, but most people call me Jill. I've been a GP in East Surrey for the last 10 years. Prior to that, I was a GP in Cambridge and Suffolk. I'm also the director of Growing Health Together, which is involved in health creation things in East Surrey. And I've taken on a new lead as clinical lead for neighbourhoods in East Surrey. And Dan has asked me with him to convene the Communities Creating Health network. And that's what I'm just going to say a few words about now. So at our last meeting, when some of you on the call were with us, we talked about what you might like to do as the next step of this learning journey. And there was quite a lot of collective thirst for getting together and cross-pollinating ideas across the county, because there's such incredible work happening everywhere. And sometimes it's really nice to share that and ask questions of your peers. And we volunteered for the first session to take place in East Surrey. And I've got some more details about that in a moment. And all of you on the call would be very welcome to join if you haven't already signed up. And we were looking for somebody to host an event in autumn and then one in the new year. And a few of you kind of tentatively volunteered on the last call, but I know that there are lots of moving things that will determine whether you can do this. But if anybody would like to host one of those future sessions, please do email me. Of course, not all of us can get out and about in person because we've got very busy lives. And so we thought it would be helpful as well to continue meeting up online. And we haven't confirmed any dates for those, but they'll fall in between our in-person meetings. And we would suggest that we have a very flexible agenda where we've got opportunities to learn from one another, whether we're in this space as a community leader or in a professional capacity, to learn from one another, problem solve. We could bring in external speakers if that would be desirable. There are lots of learning materials that we can share, including the ones from the Health Creation Alliance and from C2. If anybody's got any ideas of things you'd particularly like to cover in any of these sessions, please email Dan or I. And then last but not least, this is the date for the event that we're going to be doing at Buckland Lake. And many of the places have already gone. They've gone out to the mailing list. So all of you, hopefully, and this call have already received it. But there are a few spaces remaining. So please email Megan as soon as possible if you'd like to come. And in terms of what we're actually doing, you can come at 6 p.m. and we're going to have a walk. This is the beautiful venue that we'll be at. And we'll be doing some small group sessions. And then we'll be meeting at the restaurant for 7:15 for a 7:30 start of a meal. And there will continue to be talks and learning from amongst the participants throughout the evening. If anybody's got more detailed questions, then feel free to drop me a line. Otherwise, I think that's my time up. Thank you. That stop share. I pressed a lot of buttons there and I got the right one eventually.
Thanks, Jill. Absolutely. As Jill said there, this program's helped sort of accelerate and spread, I suppose, some of these practices and helped us connect and learn more. But absolutely, this keeps going. I put it in the chat, but it does feel like it's one of those things in terms of improving how we're working with our communities and each other. The more you do, the more you see you can and should do next. And I'm sure we'll all have those feelings about what next. So we want to use that network exactly as Jill set out to sort of keep connecting, keep sharing, keep learning, keep helping inspire each other or problem solve where we can help each other to do that in different ways. So yeah, really looking forward to carrying that on after today and kind of building off what we've done so far. Without further ado then, let's get into hearing from some of the different action learning groups. I'll keep a bit of a beady eye on the time as we do this, but I think we've got about 10 minutes for each group. And I know we've got representatives from each of those action learning groups who are ready to share some of their story and reflections. Yeah, we're starting that tour. We're sort of doing a tour around Surrey. You can imagine us on a map if you like, in East Guildford. So Silma, I think, and Kaylee are going to share their reflections from their action learning group. Over to you. And if you don't mind just introducing yourselves at the start, particularly for the recording, it will just help. Thank you. Over to you, Silma.
Oh, Selma, you'll need to take yourself off mute.
Yeah, Silma, you were on mute. You might have to rewind a little while we unmute you.
Good afternoon to everyone. Neil, I need my slides. Are they on? I can't see them. Okay, better. Thank you. I am a healthcare coordinator at a GP surgery, Austin Road Surgery. I was initially employed to help with an initiative called Anticipatory Care and to revitalise our patient participation group post-COVID. Day to day, my job entails liaising between the clinical staff and the patients, and mostly non-clinical referrals needed at the surgery. When we heard about the Health Creation Programme, our manager at the surgery was keen for me to get involved. So next slide, please. So in reflection on the programme, in the first action learning session, we were encouraged by Merin to explore health inequalities our patients may be experiencing. I asked the various services involved in anticipatory care, as well as the clinicians at the surgery, where they think the health inequalities are manifested here at our surgery. Next slide. These areas came to my attention. The confusing maze of the art of signposting, what is available for our patients locally, how can we help them to access it and to connect with the wonderful resources, the charities, the action, the support groups, everything that's available already. And how can this happen with as little as possible direct input from our referral fatigued clinicians? And we explored this at our action learning session. Social prescribing says that the main theme for referrals from us, once they have had in-depth discussions with our patients, irrespective of the initial referral reason, could be termed as social isolation and loneliness. The nurse said, please, can referrals happen without our involvement? And the GP said, please, can you involve our carers more? Next slide, please. So, as an action, we had a coffee morning that we hosted here at Austin Road Surgery, specifically inviting our patients who have been referred to social prescribing and GPIMs in the previous 9 months, as well as patients coded as carers or having carers, along with their carers, even if they're not registered at our GP surgery. This was a walk-in event in our reception area over lunchtime, with social prescribing, action for carers, GPIMs, and our beloved GP present for a chat. For the RSVP, we had 7 accepted from social prescribing referrals from the last 9 months, and 1 from GPIMs, but 23 of carers as well as those that are being cared for. And yeah, the surgery was absolutely bustling. People dropped in and dropped out and came and went, and it was really met with an overwhelming support. Next slide, please. So it was in our hearts to create an opportunity for various services to connect with our patients and for us to listen to what our patients have to tell us. Next slide. The patients who were here were very keen to come again. Those who had to miss out asked if we could please host another event. Clearly, our carers can benefit from more signposting and support, and we were surprised by what we learned from our patients. I was very surprised to learn that our carers are so keen for mental health support. They specifically requested a form of group support, even if their issues cannot be privately discussed. They're keen to just have it out there. Please, can they just have more support? Next slide. Moving forward from here and spreading the learning more widely, we are 6 healthcare coordinators in our primary care network, our PCN, and we are alert for opportunities to work together and to connect with each other and to listen to what our patients need. We are hoping to see more events in the future where we can connect our patients with the services that are currently already available here locally. So over to Kaylee.
Thank you, Silma, and thank you very much for the invitation here today. It's really lovely to connect with you all. To introduce myself, my name is Kaylee Moyes, and I am the PCM manager for East Guildford. So the practices that I support, we look after just under 60,000 people within our geographical area, and that's rising all the time, mainly due to some big housing developments within our patch. The main thing, the framework of the Health Creation Alliance, I think, has ultimately helped me network and to see just how important it is to carve out time within a very, very busy schedule to look at how we improve and communicate with our neighbourhood team. With a healthcare hat on, it was just really great to see colleagues from voluntary sector and council and third-party organisations and what they're doing within the same geographical patch as we work. So we don't want to create duplication. So for me, it's been about reaching out to what already exists, what already works for communities, and how we can support these people live healthy and independent and fulfilled lives. And one example of that is I had no idea about the Surrey Information Point and the Healthy Surrey websites. Never had come into my radar. So this has now been added to all 6 practice websites. We've spoken about it at PCM board meeting. Another example is I protected some time to attend the Voluntary Action South West Surrey conference. And here I learned about A Dose of Nature, which is a psychology-led programme at DAP June, helping people with mental health challenges, and all 6 practices are now referring into that service too. So some projects that we've been working on over the last 12 months and also this financial year we're in now. We've been looking at how we can help improve the access for people experiencing any form of homelessness to a GP practice. We've been looking at sleep advice and support with insomnia. We've got diabetes groups now, and we're currently looking at a mental health wellbeing support for young people who may be on waiting lists for referrals to places such as CAMS and similar. But our focus for this health creation work was looking at social isolation, like Silma mentioned, particularly in the more elderly population. So we've started looking at a coffee morning social model, and this includes community transport, and it engages people with lower limb skin tears, ulcers and so on. So these people may tag themselves as being housebound because they don't wish to go out due to the leg complaint. And the club gives them a social setting. It's got events such as entertainers, chair fitness, hairdresser, anything that they fancy and that we can find within our local area. And it's also staffed by nurses, so they're there to redress their legs while they attend. And research in other areas has shown fantastic healing results and improvements in the members' mental health. And the people that have healed tend to stay on for life, and they become the volunteers making the teas and coffees, and they're no longer housebound and they've got a circle of friends. So our next steps are continue all our project work that we've mentioned using quality improvement tools. So we need to keep a really close eye on what's working and what's not. And we need to reach out to our communities more to hear what they think, what they want, what already works for them, and then we can expand on those ideas. I think as a group, we need to continue to strive to create that one door system so a community member can access us through any pathway and they'll start to feel supported. And finally, from me, I think it's great to meet you all and just to keep learning from each other. So if there's anything that I've mentioned that you think might be useful, please be in touch, and I'd love to hear your ideas as well.
Thanks so much, Silma and Kaylee. Really great to hear the work you've been doing with colleagues. And as I was listening, I was reflecting on the way you've kind of set up different ways to listen and respond in those examples, inviting people into a slightly different conversation, posing slightly different questions, listening in different ways, and also that example you gave there, Kaylee, where sort of someone who we might see in the bracket of needing support is actually giving support to others, right? And that's so powerful. So yeah, lovely examples. And on your point there, Kaylee, about the kind of ongoing conversation and sharing, and people who'd be interested in more of what you're doing or other things you hear on the call, Health Creation Alliance colleagues have helped to put together, I know lots of you have inputted to this, a sort of prospectus, a summary of some of the work going on across all the different action learning groups. So once that's finished, we'll be able to circulate that, and it will have contact details for different examples and things. So yeah, but absolutely brilliant. Thanks so much for your examples and for getting us going. And now we're going to whiz. This is not a sensible or efficient physical journey around Surrey, but as we're online, we can do it like this, can't we? We can go straight from East Guildford to East Surrey with absolutely no hesitation. So I know colleagues Sandra and Marta are going to talk a bit about the work in East Surrey, and it's really interesting. Colleagues from C2 Community Connectors, hi Hazel, were already, before we started this programme, supporting work in East Surrey around health creation with Jill, Oro and others on this call. And it's been great to have C2 working as part of this sort of health creation family to support the work there. But over to you, Sandra and Marta. Thank you very much.
Well, hello, I hope you can hear me. I'm Sandra, as Dan said, and I work in a team at Surrey County Council that is all about trying to listen to residents and to share what we're hearing from our residents within the wider organisation, so that we can, respond and or support them in the best way possible. So I just wanted to say a little bit about my journey so far to date. And I was first introduced to health creation and C2, if you like, in an online seminar that Lord Nigel Crisp and Gillian Orrow spoke at, and they spoke about the health creation almost revolution that was already starting to happen in East Surrey. And I could immediately see synergies between this health creation that they were speaking of and our county council's goal of supporting residents to help each other so that our neighbourhoods could begin to thrive, or thrive even more so. So I also had the privilege of visiting Exeter with C2 to see health creation in practice. And I met the very ordinary, but at the same time very extraordinary residents who were banding together to transform their neighbourhoods, their lives, and the lives of many other people. And I was absolutely sold. I mean, I was sold at the online conference, to be fair. But when I saw, when you see the fantastic results and what people are doing on the ground, I actually just wanted to know, well, how did they do this? What's the secret? What's the magic, if you like? And so for me, the Health Creation Action Learning Set that I was part of, and I was in the east of Surrey, so the lovely C2 led our program. But, it was just being able to understand the principles behind, the work that they do to support communities to help themselves, as they were doing so effectively in Exeter. So, just those principles of being community-led or self-organised, and being place-based and collaborative, and, that sort of listening to residents and responding to, to what they see as being important. That sort of using their own strength and talents already there so that they can create the conditions, they can self-organise, if you like, and create the conditions that they need to make change locally and network with each other. So since then, learning about the how, I was able to kind of synthesize that, if you like, and do a bit of a learning or sharing within my own service. So people that had not been on this action learning set also benefited from hearing about, the fantastic work that was going on in Stoke-on-Trent and Exeter and all sorts of other places around health creation. And in the last 12 months or so, as a service, we've been getting out there more and talking to residents about their communities and listening to what their ambitions are for their own lives, but also for their communities. Now, I'm going to hand over to Marta, who will hopefully be able to tell you a little bit more in terms of what's been happening locally in East Surrey.
Thanks, Sandra, and hello everyone. My name is Marta Hoku. I'm a community link officer working for Surrey County Council in Cover and Tendridge. And I want to thank you very much for this opportunity to tell you 3 stories about Hurst Green, and which is one of the areas I work for. So Hurst Green is a village in South Tendridge near an affluent area of Oxted. Hurst Green has been identified as an area of need with pockets of poverty and some historical destitution. Around this time last year, Surrey County Council sent a local area coordinator, my colleague Caris Williams, and a community link officer, yours truly, to the area. So Caris, as a local coordinator, started walking alongside residents, focusing on building trust and supporting them with their individual needs. I, on the other hand, aim to build and link a network of residents and organizations, the stakeholders of Hurst Green, and understand what's important to the local community. So some of the issues there we identified was a lack of access of services. So there weren't many assets in the area. For example, residents had to travel almost 15 kilometers to attend a job center, or 17 kilometers to go to the hospital. Transport is also an issue. So if you don't have a car or you can't drive, you rely on public transport, which there is not many options available, or can be quite expensive. Or you can use taxis, again, very expensive. So some people are spending £80 for a round trip to the hospital. So it can be quite a lot. But I want to focus on what is strong in Hurst Green, especially because residents have a great sense of community and most of them enjoy living there. When we started out working there, very soon Caris identified that lots of residents she was walking alongside were concerned about the sharp increase of cost of living in the UK, and many were very worried that they would find themselves in that awful situation where they would only afford to pay for food or for keeping themselves warm in the winter. So Caris and I started to connect key people in Hurst Green, residents and professionals, including some of them that were involved in the health creation program. And together we had conversations of what could be done about it. So the local vicar, Reverend Anna from St. John's Church, who is actually getting consecrated as a Bishop of Ripon today, and Abby Chapman, a Hurst Green resident that runs a local charity called the Accessibility Project, got together to deliver Hurst Green First Warm Hub, which they called Hurst Green Community Hub. It's entirely run by local volunteers. It became a space where local people, mainly older people and mums, could spend a few hours of their afternoon having a cup of tea or a conversation. Initially, some residents for mobility issues couldn't access it, so the group reached out to East Surrey Rural Transport, which provided a van and a driver to pick up anyone interested in attending the hub. So the attendance has been great. Lots of the usual hub users have been made friends with each other. It has been tackling not only fuel poverty, but more importantly, social isolation and mental health. They also link in with the community fridge that is run by the church and by local volunteers. So I would also add that it encourages people to eat well. The hub has been taking place still after the end of the winter and is growing strong. They are planning lots of activities during the summer. Another project I wanted to highlight is the Health Checks Clinic, which is so the first time I stepped in Hurst Green, I listened to a resident who really wanted a health clinic that would be available in the area at least once a month. Something about like for diabetes tests, hearing checks, general health checks, etc. Listening further to the community, people were telling us that it was hard for people to get to the closest GP practice in Oxted. They didn't want to bother their GPs, or some couldn't remember the last time they visited their GP. So I introduced them to the Alliance for Better Care, which is run by Eva Bangova and the excellent group of health professionals to that key group of Hurst Green. So in March, we piloted the first health clinic, bringing services to the people. They did really well, and so they were bringing the clinic once a month to the area, and it has connected again residents to their GP. And the third story will be really quick. I'm sorry. So because it's a really, really special story, and I'm going to tell you on behalf of Caris. However, she's a much more compelling storyteller than I am. So if you have the opportunity to talk to her, ask about it. Caris started to walk alongside Paula. So Paula is a resident of Hurst Green who was going through a tough patch, physical and mental health. She had family issues, financial issues. I'm not going to get too deep into it because it's not my place, but a lot was going on for Paula. Despite all that, Paula has this amazing gift of being a great friend, of bringing people together and making them feel comfortable and accepted. And she always has time for other people. So Caris asked Paula, what did she want to do? And Paula said she wanted to set up a craft group to help her sister with her mental health issues. So they went out and found an old lounge that wasn't being used in a sort of forgotten part of the village. And then Dr. Anna Musto from Growing Health Together gave them £200 from the funding pot of the Growing Health Together to help refurbish a bit of that place and make it more welcoming and store all the crafts material that they needed. So every Tuesday, everyone can drop in and have a cup of tea, have a chat, and do some art and crafts there. So people start coming, a sisterhood start growing. They were not just doing art, but they were talking about all sorts of things. They shared their issues, they helped each other, they were giving validation to each other, advice. We were talking about women, some women that couldn't even leave their homes because of mental health or mobility issues. So, but still they were coming to this group. So Caris started to identify some common needs. She started to invite key services to the group, just to be there, just to listen, and then to think about how services could be designed and adapt, providing a better support to those really hard realities. So the group members are growing in confidence, and they know now that their voices really matter. They have many ideas, They are keen to make things happen. They're organizing game sessions to young people. They went on a trip together the other day. Some of the members even started a new group, a fibromyalgia support group. They call themselves the Fibre Warriors. There are women coming from other villages in Tendred to this group, and Dr. Anna Musto is introducing them to, I might pronounce this incorrectly, I'm sorry, Dr. Bethan Borgi from Oxted Health Centre to visit the group to share her knowledge and support about fibromyalgia. So there's some other examples in her screen, but I think these stories illustrate a bit how residents in her screen are taking agency and making life better for themselves. Thank you.
Thank you so much, Sandra and Marta. You crammed an amazing amount in those stories, and thanks for the generous way you shared Paula's story there. And I was reflecting on the focus on her strengths at the heart of that, and the amazing things she's done with a whole, like you said, a whole cast of different people in different organisations and roles getting behind what she could do and wanted to do for her community, for her sister in the first place. But and I was also thinking, wow, if we started, you mentioned those women traveling from quite a distance to this lounge venue in her screen. If we started with what service should we provide for those people 20 minutes away from there, would we have arrived at what you've just described? I very much doubt it. Could we have commissioned it? Unlikely. So yeah, that's an incredible story. Thanks so much for sharing it. Really appreciate that. We're sticking with a slight theme here because we're staying east, if my notes are correct. So I think we're going to go to East Waverley, and I think Sonal, you were going to kick off here. Thank you.
Thanks, Dan. Yeah, I'm the facilitator for the East Waverley group. Unfortunately, colleagues who could have talked about the group's journey today weren't able to be here today, so they asked if I would present on their behalf. Now, the first session with East Waverley was spent looking at data, hard and soft, and this was to try and identify a group that they would like to work with. And through our discussions, looking at the data, unpaid carers was the group that was agreed upon. And this was not only due to the inequalities that they experienced due to their caring role, but also because of the pressure that they relieve on the system, because of the caring roles that they take on, and this is quite often under-recognised. So it was really important to the group to see how they could work alongside unpaid carers. What one of the initial actions the group decided to undertake was a mapping exercise of local carer support services, and this was to help them understand where the strengths are and what can be improved. And what quickly came to light was that there's a number of services in what would be classed as more urban areas, and appreciate there's we can describe urban areas in a very rural county like Surrey quite differently to somewhere like central London, but essentially there were there was plenty of offerings in those more urban areas, and there was lots of online offerings, but there was very little face-to-face support in more rural areas, and it was felt that this is what needs to be explored in a bit more detail. So members of the group took it upon themselves to spend time having conversations with unpaid carers, and we had a discussion about to what extent they can go out to where carers are, or because of the kind of the current challenges around capacity in primary care, actually how much they can try and do it through their day-to-day work. So it was just, they decided to do it on sort of as much as they could through their day-to-day work. So, for example, we had a community matron and a couple of social prescribers who were, they had unpaid carers who they were seeing through, through their services. So it was through that as much as possible they tried to hold those conversations. But we did have some other colleagues that were also able to attend support groups for carers. And they started to connect with those who not only run the groups, but the unpaid carers who attend them as well. And the conversations were very much focused on what matters to the carers. Now, one of the challenges with this work is the very nature of caring responsibilities, and that meant actually being able to bring carers into the ALG sessions was difficult. And the other thing to mention with this group is that actually they weren't able to start the programme until January. And that meant that they not only had a shorter timescale within which to work on the programme and undertake their actions and you know, kind of reflect on the learning, but they, you know, they only had 4 sessions with me as well to kind of help them through that process. However, I think despite these challenges, I think there's been some really, really good learning within this group about how they need to work differently as professionals and with each other to make, you know, in order to make this way of working stick. And actually by the time we got to the final session, the group had identified someone who had set up a support group while she was a carer herself. Her husband has now unfortunately passed away, but she's still very passionate about supporting unpaid carers, and she's continuing to develop her group's offer as well. So during that final session, we heard from Carol and the group she'd set up, We Care, and all the fantastic things that they're doing, and actually where she wants to take things next. We had a discussion about what worked well, what support had been helpful to her, some of the barriers and hurdles that have come her way, and what support she may still need to overcome them. These were really, really helpful discussions as they helped inform how working with a wider range of unpaid carers could be taken forward. There's the key learning for this group, and as I said, because, you know, it was very much because of the sort of, you know, some of the kind of challenges that this group was kind of working through. The key learning for them was actually very much centered on how they work as professionals. It was, you know, it was clear as kind of time went on, there was a real mindset shift that was occurring amongst members of the group. This is, you know, it was acknowledged that this is a very, very different way of working for professionals, not just the NHS, but actually those with social care and charity backgrounds as well. They were saying that, you know, as professionals, we've been trained to be detached and not talk about ourselves, but actually once you start to open up about your own experiences, you know, kind of that kind of truth telling, from a personal experience, actually that's what helps to build trust. And I think the other thing that they were really sort of keen to convey, that actually, you know, that because we're talking about, you know, quite often we're talking about shifting mindsets here, and from a medical model to a health creation model. If you know, if clinicians, especially those in primary care, are under pressure and there's not mechanisms to free up their time to engage in work like this, then actually that mindset shift is going to be quite difficult. But they've got some areas for development to take forward. So engaging, you know, they've learned that actually engaging carers face to face where they meet is the best way to go about things. That's the social element, and the peer support is most important, and you can develop from there. And actually, you know, I think that reflects one of the comments in the first presentation about, you know, the carers and the mental health support that they need, that they don't mind if it's, you know, in a slightly more open space with other carers, because actually that peer support is so important. What we heard from some of the our voluntary and community groups and social enterprises that were part of this group is that actually, you know, relationships with the NHS are really good for resolving clinical issues, but there's so much more that can be done, you know, to try and sort of build those relationships around non-clinical issues and the prevention agenda more generally. And support, and the, you know, the group's really keen to actually get out as much as they can to more support groups and the community offerings that are in place. This is a really good way of identifying the talents and strengths, you know, of the people that they want to work alongside, because actually you see much more of the person, you know, in these kinds of settings than you would do in a clinical or a care setting. But again, for non-NHS partners, it's been very helpful to understand the inner workings and pressures on primary care. For them, I think it seems like the NHS can seem like a closed shop at times, but it's, you know, they appreciate now it can be very difficult to step back and shift from that reactive mindset when you're so busy. So I think that, you know, the relationship building that's occurred between different partners has been really important for this group in this programme. And finally, I think just accepting that, you know, complex issues aren't solved quickly. Incremental steps are okay, and again, that's something that helps to build trust and confidence. And they're very keen to understand actually how they can support more connections between carers, because that was something that in the final session came to light, that we heard from this one lady that had set up a group, but actually we had a couple of new people in the room as well that day, and they were saying, actually, we know a chap over here who's doing something and someone else over there, so actually maybe we need to be connecting these people up and seeing how we can support them, to build on what they're doing, and they can take that forward together. I think some of the strengths that this group has, that they've displayed, they're working on really well, are things like listening and responding, the truth telling, trying to see that strengths focus. And as I've touched on, it's the they've really had a focus on building those relationships as professionals, because actually it was a group that didn't know each other very well, and I think being able to kind of get on the same page as professionals was really important for them to then be able to start working with working with the community in a different way. So I think that that community capacity building for that the next steps for them, that's going to be the really that their real focus going forward now. So short and sweet from me, I'm afraid, Dan.
No, that's perfect, Sonal. Thank you, and thanks for. It's a shame I know the group members of the group couldn't join, but thanks for representing and sharing those reflections. And I think the value of the relationships in all of that between different professionals in all these stories and examples. There's such a wide array of people, aren't there, with different skills, but also different sort of positions, I suppose, in the system, with different responsibilities. But the value of those connections, and also I think thank you for highlighting some of those practical things that can make this really hard, whether that's sort of challenges on time, other pressures. It's really important we've got our eye on them. It's not just great, this makes sense, let's do it. There's some real practical and mindset challenges around it as well. So thank you so much. We're going to have from one more group before we take a sort of half-time break and stretch our legs. And we're going to hear from CoCo next. And I think I'm handing over to, well, I know I'm handing over to Vince and Pippa. And I know you're going to introduce a short video. I think the technology might mean we need to focus on the subtitles, because I think there might be a bit of a challenge making the sound work for everyone through Zoom. But I'll hand over to Vince and Pippa. Thank you.
Okay, I just wanted to introduce myself and just give you a sort of backdrop and a journey to where we've got to today, which would be really great to talk about. So who am I? I'm Vince Lydon. I work for Runnymede Council as a community engagement officer. This has been an amazing journey for me, because right at the start, I'd only just joined in this role. So for me, it was really great to sort of being involved and being engaged in such a great model, such an interesting opportunity to develop my role, my skills around something that was absolutely outstanding to meet with so many different people across the community as we move forward on our journey. So what I wanted to talk about was what was our theme, and really just to really think about what we were focusing on, because I guess our focus was around mental health. It was really thinking about addressing what are some of those gaps, particularly around mental health crisis and services, and particularly our role within those community spaces. So what did we do? We sort of thought about how could we apply some of the things that we're already doing around some art groups that were already being delivered out in the community, and listening to community members and trying to develop further what that could look like, but also what was our public face? How could we create more publicity around Runnymede, around the things that we're doing? How could we communicate more effectively with the community? I'm really sorry, you can hear my dog in the background, by the way. So a key point was, a key learning point was communities can create health themselves through connection, and as roles, our role as professionals to enable that as a lead. So whether that was the PCNs, whether that was ourselves as a authority, Runnymede, as a local authority, we were able to work collaboratively together to connect and achieve some key learning points. So thinking about our learnings, we went through a diagnostic in meeting 2, which opened our eyes up to possibly some of the things we weren't doing, to work together across sectors. We've touched upon duplication in the past, and I think I've come across that a lot in my role with different organisations, and how we could work together more collaboratively. As a professional, as a community engagement officer, reflecting on what I do and how can I share those experiences, but also listening to people about their own experiences and how they're struggling with mental health as well. And how can I kind of absorb that and really think about what that means. We look to invite people along with lived experiences within the space as much as possible, so that we can really help the group to be driven forward with their experiences, and to reframe what that looks like around things around engaging people and social prescribing, around engaging with the community more effectively. Some of our strengths were, and what we continue to work on, was about being transparent, being honest, and responding to that. What are, focus on our strengths, self-organising, relationships between us around community members, the NHS, the PCNs. How can we work more effectively together as a group and as agencies, and thinking about what are the key principles about what is the capacity out there to work together, co-designing, co-production, and community-led action, which is very much what we looked at achieving with the group that we had together, which was a mix of professionals. But as we involved more people from that lived experience, it was giving them the skills and the confidence and the empowerment to be able to go out there and create some change, and to create some ideas that we could help them to build and give them the platform to launch forward in a very exciting way. Our ambitions were to try and increase that confidence, to influence some of the key agencies out there, and to be able to help them to develop and grow. And I think those are the things that we really achieved as a group, as a key group. And I think leading on, and I want to pass you over to Viv, because I think my dog will take over my presentation at the moment, is what was the next steps? What did we hope to achieve within our health creation group, and certainly that onward journey for us?
I shall take over then for a moment. Just building on what Vince said, he's covered an awful lot, as you can hear. The group that we worked with were phenomenal. I said at the beginning of the chat that it was the respect between them that really blew me away. They recognised in each other their strengths, and they went all out to support each other with that and make sure they drew out the strengths in each other. And you could really tell that they'd gone through quite a mind-blowing experience, and they'd had 6 weeks of being in the system, being looked after, and then they were suddenly back in the world, and they were nowhere near ready for the world, and they were daunted, and they still are, to be fair. They've still got a fair way to go, but they have helped each other so much. And there's no question that the programme that we went through with Merryn gave this structure that made all of us feel clear about what we were all doing, and we could support them. And there was very much a recognition that they wanted professionals to feature, which is a huge compliment, to be honest, but they didn't realise quite how much confidence they were giving us as well. It was the most amazing, balanced, flat hierarchy, non-hierarchy really. we've put together this video. One of the people, we weren't able to get her included. I couldn't edit the video, sorry. Tech skills are not my forte. So I've just written a few words that she said, and then after that, Neil, if you can play the video. So what Philippa, one of our colleagues from Surrey County Council, said was, this group is so pragmatic, so courageous. Brian's artwork that speaks volumes, Mike's leadership and energy and ideas, and the formalisation of the process. What you're doing is unique to set up from the wilderness of after a crisis and then to gigantic scaling, the scaling issue to get back to the version of reality you are most drawn to and to sustain that. Beautiful words.
I'm Dawn, a social prescriber for CoCo PCN. I have been part of the Health Creation Alliance programme over the last few months, and it's been amazing to watch individuals who came together and said, we need to do something as a community, we need to help each other. From the Health Creation programme, they've taken on board listening to each other, listening to professionals, help all of us coming together, obtaining a room, and just self-organising. They've gone from meeting weekly to creating social media page, to creating information, sharing information, and having days out and trips. And what I've seen, the kindness that they've shown each other, the learning that's come from it, has been absolutely amazing to watch.
I feel that what we've learned together as a group is been more by osmosis than actually pinpointing exact moments that we've learned something. We've bonded together as a group and we learned to do things together. We've bonded together in a way that we're just people that need help, and we're trying to help each other in a way that any way we can.
We then started to start a group up, a hub, an information hub in Addlestone. It's a free large room at the top of Tesco's, and we're lucky to have this room, this space where we could start this hub, giving out information with leaflets, advice. There was all sorts of people there with different circumstances, depression, OCD, anxiety, bereavement, lots of different circumstances. So then we started this hub, and we started to make lists of events going forward. So it would give us a purpose, some structure and some dates for our diaries. So we started to do walks, golf, different events going forward, seaside trips, lots of different things. And then we started to meet up every Friday at 2 o'clock. So we had that to look forward to. We were lucky to be given this opportunity. And Dawn's always there with a cheerful smile. We've got coffee, we've got biscuits. Best advice I could say is
thank you. Because it's an energy of recovery. Yep, it's not an energy of and working on the mind every day.
That's lovely. Did you want to add anything, Pippa?
Yeah, I will do. It was Dawn that they were referring to in the video, and it's just amazing, that video. I know it's very basic, but it encapsulates everything, and what an amazing group. In that last scene, we were in the local park, and one of the guys just loves singing. He just sings the whole time, and it's so nice, it's so fun. And where Dawn was at the start of the video is Home Farm, which I'm really hoping we can get you to at some point. We're working on it. So yes, thank you everybody, and thank you for having us here today.
Not at all. Thank you, Pippa and Vince. Amazing stuff. Really lovely video. Yeah, that was Elvis, I think, at the end there, wasn't it? But yeah, lovely video. Amazing stories again. We're going to take a break. We're slightly behind, but I get to do that thing like a pilot where you sort of say, yeah, we'll make up the time in the second half of the journey somehow, but we will. But should we take a 5-minute break? It's probably easier to stay connected and just feel free to turn off your camera, etc. And yeah, stretch your legs, grab a cuppa. Can we come back at 12 minutes past, please? And maybe pop yourself back on camera at that point so we know everyone's back in the room. See you shortly. Thank you again. Hi all, hope you had a chance to refuel. I'm sure some might be sort of coming back gradually over the next couple of minutes. We are slightly behind, so we'll kind of crack on as others come back into the room. Yeah, we've got another 4 groups to hear back from, and we're going to move to Epsom next. And Sam, could I pass to you? Hoping you're back on the call. Can't quite see everyone yet, but hand over to you now, Sam, if you're there.
Thanks, Dan. Yeah, I'm here. Can you hear me okay?
Yes, thank you.
Perfect. I think we've got some slides that we're going to go up, but I can start chatting without them.
Yeah, 1 second. I'll pull them up. I'll just sort out the spotlights. Yeah. Okay.
Thanks, Neil. So in Epsom network, I think we've gone down the route of, sorry, I should probably introduce myself. I'm Sam Algid. I am a GP in Epsom. I'm the clinical director for the network. And I've been working with Rachel, who's on with me today, our operations director. And essentially, I think we took the fuller stocktake probably as a good example when we started doing the health creation work about starting to bring together different community groups. If you go to the next slide, please, Neil. So we asked ourselves the question about why are we doing this? So what happens when the right people aren't involved or linked up? Next slide, please. And I think it just started us having those conversations about, reasons for the importance of working together in a collaborative way. Obviously, the most recent of those is potentially the one that's been hitting the headlines very recently. The Metropolitan Police is saying that they don't have capacity now to attend emergency calls for mental health crises. The argument is, are they the right people to respond to these when people are in crisis? But obviously, if they withdraw that service, what's going to happen to those individuals? There was also other ones that were highlighted, social cases, the death of 2-year-old Awab, who was essentially died, unfortunately, after mould. The coroner's cause of death was respiratory failure in 2020 as a result of severe mould inside his social housing flat. We've also got Ella, who lives about 30 metres from the South Circular, and essentially had 25 A&E admissions between the ages of 7, 8 and 9, and unfortunately died about 10 years ago now, just after her 9th birthday. And I think it makes you realise that we can only do so much in our silos. Within the NHS, we can only do so much. And I think that's what really triggered that drive to pull people together. So we use the health creations and the fuller stocktake as a good example to try and bring those community, those public service connections and try and get people working in a more collaborative way. Next slide, please. So for us, we took the route very much of trying to network our wellbeing service into more of a neighbourhood model. So the health and wellbeing service was developed in Epsom. This is the leaflet that we have available to our population. And it essentially covers all sorts of things. So people can speak to them about anything, social issues, mental health issues, and even simple things like, wanting to get fitter or feeling lonely. They really are a one-stop shop for anything that is non-medical. And I think we've gone out of our way to try and strengthen the connections with the various voluntary sector, community sector groups and our council public sector colleagues. And we did a series of attending drop-in events. One of the mental health charities does a sort of pop-up supper in the evenings. We went along, we spoke to people and we asked them what they wanted. One of the things they said is they didn't know where we lived essentially and who we necessarily were. So I think we came up with the idea of having wellbeing hubs that people would start to identify with. And that idea has amalgamated, so it won't just be our team, it will start to become an integrated approach. So we'll also have some debt counsellors involved, some housing support officers, potentially youth workers, and really that list is endless of people that we can bring into these hubs to try and make them a collaborative support option. So if you move to the next slide, I think the question then came about, how do you set the service up? Obviously, with the additional roles budgets that networks get, we were able to recruit a team of, we've now got 6 who work across our population of 60,000, 62,000, and they cover 7 different practices. So geographically, logistically, it's been a little bit of a minefield trying to run the service. So instead of embedding them into one place, we went for the option of the aspiration was to actually come up with some sites across the area that wouldn't even necessarily feel medical and make them feel more like community spaces. So if you roll forward a slide, we have started to create drop-in centres. So the team, you can refer to the team, any member who sees someone within the community can refer into the team. But also we now run a drop-in service, so people can present themselves for about an hour and a half in the middle of the day. And the plan being is we set these hubs up so that they start to become spread across our geographical area. And I think that was touching on someone else's point about people don't have the money for taxis or public transport. So actually it's trying to get the service to where it needs to be for them. Move forward, please, Neil. Currently, we've got a church that we've been working with, St Barnabas Church. These are sort of in a very slightly unprofessional way. We've just used highlighter, but it gets the message across. We've basically looked at our patch to try and show where the sites are for our population. We've got a church we're working with who are actually redesigning their atrium to turn it more into a cafe and a wellbeing space. We've acquired a council building in the centre of Ewell, which is actually a little 1-bed bungalow, which is just due to open shortly. And we've also been working with a team who are in the Wells community. So in Epsom, you probably realise that we're famous for Epsom salts, which come from the Wells. And there is a little community of its own, essentially, of about 300 houses that have their own community centre. And they have managed to secure that community centre for whatever public service they wish to use. So we've been talking to them about having a wellbeing hub there as well. Move forward, please. I think within Epsom neighbourhood, it's not just us. We also work in collaboration with ICP, which is one of the other networks which actually overlaps our patch. So as you can see, we've got a spread of yellow dots across our area. Yeah, the next slide shows we're also looking for one which will be just out to the left of where all these yellow dots are, which is over towards ICP. And we know we've got an area of deprivation in that site. So certainly they are also now looking to try and secure a wellbeing hub in that area. And that will start to open this network up. So we will hopefully have wellbeing hubs available and within walking distance for the majority of our population, which is really the dream. We've also got aspirations that we will hopefully get a roaming minibus service that then may be able to actually take people between the hubs is something we've been speaking to the council about. And we've also been talking to ICP recently about whether we might be able to secure essentially a disused ambulance. So if we can't actually get a physical site, we may be able to get a mobile site to pop up in the form of an ambulance and actually drive around to some of these areas of deprivation where we can't secure buildings safely. So moving forward, I think it's been yeah, it's been a fast and a rapid journey over, I think, the last 12 months. You know, for us as a network, we're 7 practices that hadn't traditionally worked together, a large population. So it's been an interesting journey, just getting 7 individual businesses to all play nicely and talk together. But it's been a really lovely journey, and I think there's a lot of trust and a lot of real good feeling within the network, which has been really lovely. And I think for us, obviously, we're learning to work together with another, with ICP as a PCN. So again, you know, I think that's been a sort of evolving relationship as well. And I think as we've engaged with the community providers, I think there's been times where we've realized we have to go where the energy is, and we may have the vision and we may share the vision with other people, but there's certainly going to be some organizations that are ready to go on that journey, and others that for whatever reason are not in the right place at the right time. And I think that is one thing that Rachel and I have certainly learned, is that you go where the energy is. And it's been a really good sort of journey to get things moving. It feels like there's a lot of traction, a lot of motivation in Epsom to really drive this forward. I think we put on their frustration through to acceptance, because I think at the beginning it was really hard. And it was hard as well, just from simple things: estate space, data sharing agreements, governance, just things that you wouldn't even think are going to create hurdles, caused you know, real slow points in the journey that needed to be worked out and teased out. And fair play to Rachel, my ops director, I think, who probably bore the brunt of a lot of that work that needed to be done. If you go to the next slide, please, Neil. I think this was just questions that we had moving forward about the neighbourhood. I think blockers that we've got are about assurance, about the longevity. So certainly within the NHS, obviously we've all got on this sort of tenterhook to see what's going to happen to networks beyond March 24. And I think that's felt not just by us. I think that's also felt when we're talking about neighbourhoods and integrated working. I think there's a hesitation for other people working with us. So obviously we are trying to secure premises, but actually we can't commit to a contract currently beyond March 24, which is a little bit of a blocker in itself. But I think that we are just doing, I suppose, focusing on what we do have control of and going where the positive energy is. But I think these are the things where, you know, getting that direction of travel would start to really help this power forward again with some speed. And I think it's the final slide. So this was some pictures. In the middle there, you can see this is the new building that we've just got in Ewell. It's got a beautiful red floor that's hopefully being replaced next week. And currently, actually, my team are all pitching in. That's the team in the garden. So everyone's been pitching in to actually decorate it, paint it, clean up the garden. So in itself, it's been a team effort. We've got some pictures there as well of our wellbeing team. So the wellbeing hubs have already gone live, but currently using a room that we share with one of our practices. So this was their table set up as they were on their first day as open for business, which has been really lovely to see. I think there's one more slide. And essentially, this is almost where we've got to. I think one of the things we took home from the feedback from our population was, who are we and where are we? And I feel like we're starting to answer the where are we question. And actually, this is our attempt at the who are we question, because we realized we needed a brand and a logo. We needed people to identify with who we were. And so this has still got to be taken to Epsom neighbourhood board when it formally becomes established. But actually this was one of our takes on what potentially our logo could look like, and very much just bringing in those ideas of nature and an identity. I guess we had to get the racehorse in there somewhere. So yeah, I think that's our story in Epsom so far. Rach, was there anything you wanted to add? Oh, you're muted.
No, just thank you to Dan's supportive comments about the use of highlighters. I think it was, but no, it's been a real pleasure, hasn't it? And I think echoing the sentiments of a lot of people who've already spoken. Actually, go where the energy is, but you get so much energy from the community. It's really inspiring, and I think, yeah, being able to hand over more to them and more and more and more is the goal, because we don't want to be running these hubs. We want them to be self-sustaining. So yeah.
Thanks so much, Sam and Rachel. Really, really great glimpse into all the work you're doing. Yeah, loving the highlighter and the pictures, and yeah, the symbolism of the logo being, this is about Epsom. It's about the community in Epsom, their identity, and how we're working with that community. Great stuff. Thanks so much. We're going to hotfoot it to Farnham. So Magdalena and Joe, over to you. Thank you.
Good afternoon. We represent Farnham PCN. Next to me is Monika Wilczkowiak, who is our care coordinator.
Hi.
My name is Magdalena Szklarek. I work as a health and well-being coach for Farnham PCN whilst I'm finishing my PhD in geriatrics. I've got a background in public health, so that's my passion for health promotion, prevention, and protection. So having in mind what my public health guru, Professor Sir Michael Marmot, said, asking his very good book, The Health Gap, what good does it do to treat people and send them back to the condition which made them sick? And he answered, we need to address the condition which made people sick. Also, knowing that the life expectancy in England is 82 years, and for the deprived areas it's around 70, depending on the deprivation. At the beginning of my employment with Farnham PCN in May 2022, I've liaised with the Health Community Centre. It's in Sandy Hill area where it has been identified as a deprived area. So I soon found out that the children there are well behind with their vaccinations. Also, people from the estate, in general, do not access healthcare because of different barriers, including transport. So I had an idea we can deliver the healthcare to their premises, especially they've got the proper consulting room in their premises. So I've kickstarted a couple of projects. One of them was the catch-up immunization clinic drop-in, which was 6 months pilot. I recently heard from the clinical lead from the Surrey vaccination that they're going to expand on the project in different deprived areas as the inequalities project. Also, we instigated in collaboration with Talk Plus, a mental health service. We started the COPD group consultations in the community. And at the moment, there is a second round of the 5 weeks course. So this is developed very well. We're planning on do the same course for the people suffering from the diabetes. Also, I've been introduced to the Farnham PCN Inequalities Development Program. So they've done the survey, and there has been found out that the 39.4% from 1,935 respondents do not have enough physical activity. So I propose to organize well-being walks. It has been presented to our clinical director, and who gave the go-ahead. And given that Sandy Hill is on the doorstep of Caesar's Camp, which is a great Heartland, I've liaised with the Thames Basin Heath Partnership, with Michael Jones, also with South Downs National Park, with Eleanor Newman, and we've organized well-being walks. They have been advertised. I don't know if
yeah, would you like me to share your slides, Magdalena? We have some slides. Yeah, okay.
They're not visible for myself, and yes.
Yeah, here we are.
Just look for the first one. This is the, yes, we can please, next slide, please. Yes, so this is myself on the left-hand side, and Michael from Thames Basin Heath Partnership, and Eleanor Newman from South Downs National Park. Next slide, please. So we've advertised like directly in the Farnham PCN GP practices and also on the Eventbrite, and all 22 places have been taken. The poster has been developed by Sarah Barnes from the Thames Basin Heath Partnership. These walks were designed to introduce local people to the wonderful heathland, also make them aware about the beauty, at the same time how fragile the area is, so make them responsible and look after. Michael was the educational officer, so who engaged very well with all the participants from all age groups. And Eleanor Newman, she led the mindfulness walk. She put us in the relaxing state, reading the poetry. And yes, next slide, please. So we had people of different age. We had elderly people. There was a lady with a pushchair with, I think, three weeks old child. And we also have Ryan, 10 years old. Ryan has been brought by his grandmother. He wasn't at school for the last 3 years due to the school couldn't meet his needs. And at the beginning of the first walk, he was quite chaotic in his answers. He even stated that he's not fan of the walking or participate, but in the 30 minutes time, he was asking Michael if he can tell him more about plants. He was engaging very well. From what his grandma said, he was looking forward to the next walk, kept on asking during the whole week for the next one. And when he came for the next one, he came with the big bottle of water, whilst on the first walk he had a couple of cans of Coke and sausage roll. So, and then he couldn't attend the third walk because he had the interview for his new school, which was successful. And when he came for the last walk, he was quite sad because it was that the walks are about to stop. So because there was an interest, initially there was a pilot for 4 walks. We did another one, so altogether 5 walks. Yes, can I have next slide, please? Yes, also I would like to say that there was no funding needed to organize the walk so far. We are planning, we're going to do the taster session. We're going to invite people from the previous walks and the stakeholders. Our clinical lead, Dr. Brown, expressed his willingness to come to the walk, and we are going to do this as soon as possible. We're going to discuss the insurance. We're very lucky because we can use the Thames Basin Heath permission to lead the walks in the Caesars camp. And we're going to identify the new walk leaders, train people ideally from the community to lead the future walks, and just be supervised on the ad hoc basis from the people and students from people like Michael, engagement officer, educational officer, or students from Thames Basin Heath Partnership. And we would like to restart the walks on the regular and ongoing basis. And here are some of our feedbacks. We receive a lot of feedback, all positive. Thank you very much.
Thanks so much, Magdalena and Joe, for sharing Michael's story there. Really, really great, the connection to people and to nature in that case. Thanks so much for giving us a glimpse into Farnham. And staying on that kind of side of the county, over to Surrey Heath, I think Trevor Hogg, you're going to kick us off, and with Rosanna, I think. Thanks, Trevor.
Thanks, Dan. So I'm Trevor Hogg. I'm chairman of the Aldine Community Group. I'm also councillor for Camberley East and chairman of the Adults and the Health Select Committee for my sins. I'm really, want to talk about Aldine. 3/4 of the social housing in Surrey Heath is in Aldine, and poverty is definitely an issue there. but the biggest one is actually education, training and skills. It's in the worst 10% in the country, which is a bit of a difference from the rest of Surrey in many ways. But it drives a lot of things that are health related, and that includes communications in terms of getting through to people, simplicity, trust. They're really high up the agenda. Old Dean, certainly, low-level mental health issues are very, very predominant. But yeah, as I say, the big thing that I would say is gaining people's trust, getting to talk to them, and getting them to listen is something that you only get with trust. And we work on a whole bunch of things with the community. So we run a free food store. We run community breakfasts. We run an Alzheimer's cafe. We are just launching a junior library to get to some of the young people. We run a youth club. All of these things are actually linked. They all link into trying to actually generate better health, get people to learn about diet, change the ways, move away from reliance on fast food, all sorts of things. I'm going to hand over to Rosie, who's actually been working on one of those initiatives. So Rosie, over to you.
Thank you, Trevor. If Neil, if we could have the slides, that'd be great. So my name's Rosie. I'm a health and wellbeing coach for Surrey Health Primary Care Network. So kind of following on from what Trevor said, so what we focused on was the Old Dean. So the learning groups are really important for us to actually have some dedicated time to get together and actually look at some data to figure out where we wanted to focus. So from looking at that data, we were obviously looking at health inequalities and areas of deprivation. So Old Dean is known to be the most deprived area within Surrey Heath. So that was our primary focus. From other data, we found out that there was aspects to do with mental well-being, also health and sort of lifestyle aspects that, the Old Dean needs more support in. So in terms of what we did, we actually put together like a Live Well session. So if we just pop to the next slide, that'd be great. So first off, what we did want to do is actually get some responses from the community, from themselves, because it's all well and good, us putting in what we think the community needs, but actually we really needed to hear from them. So what we did is myself and some of the other health and wellbeing coaches actually attended some community groups within the Old Dean. What we did is it really got us actually talking within the community. We were able to chat with them about their opinions, and also we went with a few forms just with 4 simple questions just to record some of the responses. That was relating to sort of barriers to healthy lifestyle, what they do to promote a healthy lifestyle, what they felt that they needed really. So yeah, it was also a chance for them to, for us to discuss actually a bit more about the health and wellbeing service and actually, free services that are available to them. So we just pop to the next slide, please. Thank you. So from those responses, we were able to gather a load of different data, and this is what we actually based the Live Well session on. So responses identified healthy eating, looking at mental well-being, exercise was also really important, and that's what was the main factors that they found that they needed for healthy living. So predominant barriers were money, time, opportunity to actually be able to implement, these changes and actually have a healthier lifestyle. So what we wanted to do is actually create a bit of a presentation on these topics that not just provided information, but also it had resources for them and ones that were actually relatable. So things such as budget-friendly options, as obviously money was a big issue, time-friendly options as well, also free services that are available to them. And essentially what we also wanted to do is actually bridge gaps between that information, also start to facilitate some ideas, also add to support for them, because we wanted a lot of group discussions with people that they found relatable and they could also make connections with. So what we were hoping to do, that if this session was successful, is to actually then promote and build to do some health and wellbeing one-to-one coaching sessions as well as group coaching, just so it was something that was a bit of a continuation from that. So it wasn't just this one-off health sort of session. From that, we kind of wanted to set personalized goals, so people actually were taking a real onus on their own health and well-being, you know, and having a better and more involved relationship with their health. So additionally, from the groups, we were hoping that from the group discussions it might start to form some health creation as well, so setting up maybe some walking groups within the community, maybe social activities, that type of thing, so they could really build into their community. So if we just pop to the next slide. That's great. So where we actually wanted to hold the session was within the Old Dean Bowling Club, so somewhere that was actually convenient for people to get to, and it felt like, you know, we were actually listening to them. So I mean, promotion of this was put on Facebook groups, it was put in local churches, co-ops, it was given to the bowling club where we were going to hold the session, and also given to a wide variety of professionals to network and promote our session. We were also going to give away a Live Well hamper as well, so focusing on you know, mental wellbeing books, cookery books, as well as we spoke to Places Leisure in Camberley, and they actually gave us some free sauna and steam vouchers, and as well as 2 free badminton session vouchers as well. Unfortunately, with this session, we didn't get the uptake that we needed to actually run this session. However, and this is something that Trevor will lead on to in just a moment, but it's kind of that old saying is try, try, try again. So we're hoping to, from the lessons learned, is to actually implement something along the same lines, but tweak it slightly so it feels that we're really, you know, connecting with the community. And like Trevor said, it's all about trust at the end of the day with these things. You know, coming in with a bit of a rigid approach doesn't always work, and starting small is often the best way. So, you know, like it says there at the bottom, sort of more imaginative ways are needed to actually engage the Old Dean, and like I say, moving away from that norm to actually make that difference. So I'll just hand back to Trevor, who will just go through a little bit about lessons learned from this.
Oh, I think we need to unmute you, Trevor, briefly. And just if we've got probably about another minute or so, Trevor, thanks.
Yeah, and the key thing, as I said here, is you know, don't make assumptions that everyone is well educated, grounded in knowing what's you know, health, you know, what will create it. You actually have to put yourself in their shoes more, and think about where they're coming from, the things that they are having to cope with on a daily basis. And then I would say leverage off what's already successful. You know, where people have, you know, got contact, got people coming to them, sneaking in and joining them for the conversation, we found has been really, really good. We actually had a really good consultation event a couple of months ago, where we basically grafted some bingo onto the community breakfast, and because people were there for the community breakfast, they stayed for the bingo, and within the bingo we incorporated a whole bunch of survey questions and presentations of facts about Old Dean. So you know, there are various ways to sneak things in. You have to be, you know, inventive, and then the other side of it is not overcomplicating things, keeping it simple. Be prepared to be very persistent. We started a free food stall 3 years ago, with a couple of tables outside a closed church, with some allotment produce, and 2 or 3 people came along and talked, and it gradually built up. We now have 50 to 60 families being supported by it every week, because they learned about it, learn what we're doing, and as a result they're learning about cooking with vegetables, and you can see me doing a cooking demo there with my assistant, who was one of our first customers. So, you know, Rihanna, who's now 12, used to come along and collect sweets from us, was, you know, where she started, but she's now, you know, become an accomplished cook herself, and, you know, one of our volunteers. So it happens and it builds. but it's about being persistent, it's being consistent, it's being kind all the time, and accepting some things might not work, but if you keep doing stuff and you are there, you gain that trust, and then people listen to you and will engage with you and talk with you, and things happen as a result.
That's amazing. Thanks so much, Rosie and Trevor, and that message of being there. I know you've modelled that in all the work you've done in Old Dean with lots of other colleagues. Too many to mention, but that's such a great example and great lessons and wisdom, as said in the chat. Thank you so much. We're going to move to west of Waverley. I'm really sorry, Jan and Richard. You pay a slight price here for being last on, because we are running out a bit out of time. So if you know, like when you put things on double speed, can we put you on double speed, please? But yeah, over to you, Jan.
Sure. We'll speak really quickly. Hi, I'm Jan Glynn. I'm the chair of Grey Shot Surgery's Patient Participation Group, and it's been great working on this project, because I've been able to work not only with medical professionals but local community partners, Richard being one of them, and it's been great, and I really appreciate the chance to listen to everybody's ideas today. It's been really great, really useful. We in our area, we're west of Waverley PCN, we have it's a strange area in that it appears to be an extremely wealthy area, but in fact there are some huge pockets where it really isn't. And we also have a demographic of much older population as well, a lot of care homes. We have one of the highest concentration of care homes in our area. And so when we looked at patient inequality, we found transport to be one of our biggest areas of problem for our patients. A lot of feedback I get in the PPG is that patients can't get to appointments, they couldn't get to the hospital, etc., etc. So we started between us, or within our group, we've got care coordinators, we've got all of us within this group. And so we started to do as much research as we could into just how bad the situation was. We found it was pretty poor. I mean, our public bus service, we get one every 3 hours if it turns up, and sometimes it doesn't. And so we then spoke together about all that we had in this area. We met as many people as we could. We went to mother and toddler groups, we went to dementia carers groups, we went to the local food bank and sat in on their lunch club and met with some extraordinary people. And that's probably changed my life, actually, with some of those people I met, to see what else is in the community, what else is here. We have a reasonable connected group of community transport type cars, hospital cars, etc., which Richard is going to go through and tell you a bit more about, and also the hopper service, etc., etc. We met with the parish council, who had done a transport survey locally, and looked at all the things that they'd attempted to do, all the things that didn't work, and all the things that could possibly work. But the knock-on effect of all of this is we found that it's going to be extremely hard to do anything about the big picture in terms of the big bus services or whatever else. So we've looked at ways of engaging with the community on a more local basis. We are considering setting up some community cupboards in areas. So we think we need to bring everything to the people rather than the people. We're trying to do a coordinated attack of coordinating all the local voluntary services, all the local voluntary car groups, everything else, to take people to various things. And it's not just medical, it's social things, because that's really important for mental health. You know, dancing, singing, whatever else. It's trying to coordinate all of those things through a mapping service, which we'll talk to you a little more about. But also we are looking to set up things like a community health and wellbeing hub again, and in the hope that we could make it mobile and take it again to the people and to the areas where we service, but also to try and spread as much information about what is there, because there are things there that people don't know about. So we've got a screen in our surgery. Various of our surgeries, we're going to put information about the local hopper services on the screen, local transport services. We're also going to try and coordinate some of the local transport groups to bring people to the surgeries for, you know, set times, for set appointments, whatever. You know, so we're looking at it from so many different directions. And that's the one thing we have learned, is that you can't find a solution by yourself. You have to look at absolutely everyone, and we all need to talk, and we all needed to coordinate what's there, and to spread that information. So I'm going to pass you on to Richard, and he can tell you a little bit more about it. Sorry for the truncated version, but thank you.
Yeah, so hi, I'm Richard Davis. I'm the General Manager of Waverley Hopper Community Transport. So we're a community transport organisation operating across Waverley. I wasn't in the process right at the beginning, so I think I kind of came in at the point when the group decided that transport was a bit of a problem. So they brought in one of the transport providers within the area to, I guess, try and offer up some solutions, which for me was a fantastic opportunity to kind of work out what else we could and should be doing within the community. Kind of, I guess, three key things for me that I learned from the process, and we're trying to adapt and adopt within what we do within the community. First of all, communication. You know, lots of people know about Hopper, but what struck me through this process is not everybody knows exactly what Hopper does. You know, we have a hospital hopper service, we have dialer rides, we have demand responsive transport. So it's quite complicated in terms of what we do. So we've really got to work harder on our messaging out in the community and change our communication style. I think it was Rosie early on that was saying that, you know, you really need to get the right level and the right channel of communication to make sure people understand what you do. So one of the things, as an example, we've actually had a video made with drivers and with passengers saying what the service is all about, and we're trying to share that across the community as much as we can. The other thing that really struck out for me is borders. You know, so Waverley Borough we operate in, you know, each of the surgeries tend to operate within little areas. Our areas that we operate in don't match those. So there's a lot of work that we can do to break down those borders. And, you know, again, I'd say we're a very traditional company and we've operated in the same way in 20 years. So, you know, through this exercise, we've kind of listened to the community, and there's some things that we will try to do differently to make a deeper impact. And then the final thing for me is coordinating between the different services. You know, as part of this programme, we met here at our offices actually with all the voluntary car schemes across Waverley. And, you know, for me, just to understand what they do and they even to understand what we do, I'm pretty sure by working more closely together, we'll be able to fill some of the gaps that exist. So, you know, it was a great process to go through to meet people across the community and to really listen to what people want.
Brilliant. Thank you so much, and thanks for going rapidly as we run out of time. No, amazing examples and like a different perspective, I suppose, into another bit of the jigsaw in a community and how important sort of that local transport can be, or indeed where things are located, how people access them. Really, really fabulous stuff. That was so good. Just massive thanks for everyone. I mean, for the work you're doing and you're sharing here, but the generosity and taking the time to share with each other. And I know on the chat and in the follow-up work, there'll be lots more of this sort of support to each other and practical learning. I'm going to hand over without further ado, because I know some people need to get off, or certainly get off at 4 o'clock. So hand over to Merrin just to sort of some final reflections and to wrap up the session. But yeah, huge thanks. I look forward to working with you on an ongoing basis. Over to you, Merrin.
Thank you, Daniel. And I'm the person that had 15 minutes and now have 5 minutes, but I'm going to do a really quick whiz through and pick out the main points. But I just want to say thank you, first of all, because the Health Creation Alliance team and C2 team have loved working with you the last, you know, nearly 12 months. And I want to thank you for attending today, for your curiosity, because that's a really good quality to have and bring to this. I want to thank you all for all the ALG Action Learning Group members for engaging and for the hard work you've done, and for Dan and Helen for being superb clients, and also for Jill really for kicking this off and enabling it to happen. And I think just listening to everyone today, what has impressed on me is the fact that there are many starting points here, and you have all started in, in different places, but everyone has learned something because you've been curious and been prepared to be open. And discovery is a word that's come through to me. We call this the discovery learning program for that reason, because once you open up, you can discover all sorts, and you've discovered to go where the energy is, listening to the community. There's so much possibility here. And I think the biggest discovery perhaps for many of you has been actually discovering the strengths within communities and enabling those people from the communities to take a lead and to start to do stuff and see how you can create the conditions for that to happen. So I think that this sort of few minutes I have, I just wanted to spend a couple of minutes just giving you a little bit more information about the wider context, because the 8 presentations we've had today have been part of something bigger. And this is, if you go to the slides, Neil, particularly slide 2, this is a shift across Surrey, but also nationally, I think, as well. So if we go to slide 2, not that one, the one before. That's it. That's the one. So this is the shift, really. And what we've been doing here today, we've been mainly talking about relationships at the front line, because health is created in communities and at the front line between professionals and communities. And what we have been trying to do is to see what sort of shift we can get to support the whole system. To shift the whole of Surrey, and as well as working with you at the neighbourhood level, the action learning groups, some of whom have had community members within them, and where they have, those have really taken off. But we've been working with you there on what we call a relationships first approach. So encourage you to build better relationships, and there's 4 types of relationships: between community members, between the NHS and communities, between other local partners and communities, and between the NHS and other local partners. And different groups have been concentrating on different parts of those relationships. And that was shown here today, I think, but you can continue to learn and develop the relationships across all of those 4 types. And I'm quite excited about the legacy that this might help. But we have also, just to say, been working at the place level to try and connect some of this into the places, whether that's the Runnymede Place Partnership or Northwest Surrey, or Surrey Downs is the one we've been working with most, and we've done some workshops with Surrey Downs. And also we've been working to try and help this to take root at the system level. So working with the Programme Lead for Population Health Management, they're the data people, and looking to see how we can help to support health creation to sit alongside the data side of things, because community insight is data, and it's really important that we look for that, take it on and take it on board. So I just wanted to show this slide in particular to demonstrate, really, hopefully, that this has been part of something bigger, and the Health Creation Alliance has been focused at different levels. So if we just maybe go quickly past the next slide, because I've already mentioned some of the things we're doing there. You have all focused on different things. You chose what you were going to focus on, and we helped you to do the how it is, because this is a Bananarama principle here. It's how you do it, not what you do, that makes all the difference. Doing it with communities, building that connection point with communities. So if you go to the next slide, there were some highlights for me coming out of today, so I'm not going to go through all of this. But I would probably just pick out from there, apart from the fact that obviously communities can create health by themselves through the connections that they make, and that has been shown today. But also I think service providers opening up about your own experiences, taking off that lanyard, helps to build that trust that Trevor was talking about, and actually being equal partners with communities. If the community isn't coming to your event, then go to community events, and you will probably find that there's much more connection to be had in that setting. So if we go to the next slide, and I'm doing this really quickly, I just want to say that it wasn't all plain sailing, and some groups had some difficulties, which we recognise. It's always the case, by the way. You never get away with without some difficulties. But a couple of examples here are where you started to overcome those barriers. So time and capacity, by recognising community strengths and what each other has to bring, you found ways of releasing capacity, and that was really strong. And we've also asked for protected learning time, particularly for clinicians, but others as well. So there were some good things that came out of it there, but also some disappointing, disappointment in some groups. One particular where the VCSE sector had some work cut that they were doing that was already health creating, and the dynamics in that group were difficult, but nevertheless we got some really great learning out of that. But we have fed those things back to Jill and to Dan and Helen, and they have been heard. So there is something here about leading upwards, and if you're facing barriers that with the relationships, by working in better relationship with each other, you still can't get through. They need to be fed upwards, and you need to start asking for what it is you need to be able to create those conditions. So leading upwards is something that is part of health creation. So if you just go to the next slide, I think keep the momentum going. There's lots of ways here. I'm not going to go through all of these. I hope you feel inspired and energized to continue the momentum. Keep sharing. We've got some things coming out next week to help you, a prospectus, etc., to help you to share. There's the microsite, but already some groups are continuing, some are connecting into different elements. And do feel free to join the Health Creation Alliance as well, which is a national movement to help keep that momentum going. So thank you very much. The next slide, we've come off the slides, but don't worry, don't forget the health creation framework, the 3 C's, the 6 features of health creating practices, the 4 types of relationships. They are all, can guide you in whatever you're doing in the future. So keep going back to those, because there's so much in them, and keep thinking how you can apply them in what you do. Thank you so much to Sonal, to Joe, to Karen and Hazel, and to Lee and Neil, of course, and others that were involved in this programme, and Kay down in East Surrey, for example, and to everyone here. And the NHS is going to be 75 very soon, and there is a recognition that the current medical model does need to change. And this programme is putting you in Surrey ahead of the game in terms of the change that is going to need to happen. So you've got the microsite, you've got the Surrey-wide network that Jill talked about, you've got the video of this session next week coming out, and the prospectus to help you to know what each other's been doing and to share. Keep sharing, keep that self-organised approach to learning going. And we would like you to fill in an evaluation form, which will come out after this meeting. It is an opportunity to feedback, your honest feedback about the shift that's happened for you, and we can get some good quality evaluation. That will go into a final report that will come out in July or August. And don't forget to join the Health Creation Alliance. And we have loved working with you, so thank you very much indeed.